Hi friends, this is Dr. Arshin and today's episode is all about dental veneers or ceramic veneers. And these are something that are very popular choice of treatments these days, and most people want to have a great smile, and these are the go-to treatments for smile designing or smile correction. So let's come to it. What basically are dental veneers to begin with? So dental veneers are a thin shell of ceramic, generally some sort of a ceramic like a lithium disilicate, which is a glass ceramic. And the glass content in these kind of ceramics give them a highly aesthetic appearance. They have a nice translucency and allow natural light to pass through them, and they give the tooth a very natural appearance. So when you do a ceramic restoration with these kind of veneers, they appear very aesthetic and are very hard to identify as a fake tooth. So once these ceramic are bonded onto your teeth, they last a very long time. You can practically eat almost all kinds of food, and they do not stain or discolor in the long run and are very easy to maintain, right? So coming to our question number 2, which is basically how thick or how thin are these ceramic veneers and how much do you need to shave your teeth down? Now, based on the requirement of the patient, why they are doing these veneers, the amount of tooth structure that might be reduced is variable. For somebody who needs a mild color correction or a shade correction, for like example turning a yellow tooth into a slightly more whiter or a natural colored tooth, the amount of reduction can be as little or minimum, sometimes absolutely none in case the tooth is in a very favorable position. In such cases, all we do is go ahead and bond the veneer on the tooth, and it just does its job without us having to actually shave down or trim down the tooth. But in some cases, when the teeth are not in a very favorable position and when they are quite malaligned or out of the arch, we might need to have to do a slightly more aggressive preparation and bring the tooth in a correct position so that when we do the veneers, they do not look out of the patient's mouth. They kind of fit in correctly with the arch form, and they do not give the appearance of an unnatural or a fake tooth. So that basically determines how much of the tooth needs to be shaved down, the position of the tooth, and how much color correction has to be done. These are the two main important factors. Based on these factors, the amount of tooth reduction, like I said, can be 0 to about 0.5 to 0.6 millimeters based on the requirements of the patient. The third questions that we get most commonly asked are how long do they last? Again, once these veneers are bonded into place, they last a very long time. Of course, if there is absolutely no reduction required and they are directly bonded onto a natural tooth enamel which is healthy, the strength is dramatically very high and you need not fear of these veneers ever debonding or breaking that easily. And again, you can consume all kinds of colored foods also, like dark black coffee, and these restorations won't stain for a very long time, provided you maintain their health and hygiene of the gums around them. Coming to the health and hygiene part, which is absolutely the most important, if once veneers are bonded in place, the main requirement that you need to do is make sure that they are fitted or precisely bonded onto your teeth and your gums around them are healthy. The most common complications that we encounter with veneers are swollen or unhealthy gums around them. If the veneers are too bulky or there is excess of residual cement that is used to bond these veneers and that is left behind and not cleaned up properly. So I would always advise that you go to somebody who has a slight experience with doing these kind of dental procedures, or a specialist who is trained to plan and execute these kind of treatments in a manner such that they are not detrimental to your gum health. That said, you of course need to go for your regular hygienes every 3 to 6 months and get your gums cleaned to make sure that your veneers are not interfering with your general health of the oral cavity. Coming to the last question, which is the cost. Now, a cost can be a variable factor. They can be done very poorly and cheaply, and they can be done by a dentist who has a great finesse and a great lab who knows how to do the job correctly. So I would say you should go to a dentist who is trained, who has some documented record of his cases, and discuss this idea with him and ask him if he is the best person to do it, or you need to involve a specialist like maybe a prosthodontist or an aesthetic dentist who might have done more of these cases and might be more skilled and might be more trained to execute these kind of situations for you. So of course, the better the skill, the more long lasting these veneers will be, and you will be able to get a better result and a better outcome that will be stable in the longer run. I hope that answers some of your questions with dental veneers. We'll come back with another series, maybe some of the other leftover questions, and we'd like you to please subscribe to our channel and hit the bell icon button so that whenever we have more videos, you can be updated for the same. Thanks for watching and hope to see you real soon with our next videos. Thank you.